National Cabinet is today expected to decide when teenagers will be included in the COVID-19 vaccine rollout as surging case numbers threaten to derail Australia's plans to open. Federal Education Minister Alan Tudge told us yesterday on the program that vaccinating adults remains the best way to keep children safe.
When we get to 70 and 80% of adults vaccinated, then the whole economy opens up, the whole society can open up. And that includes the schools. And that's the great hope for us as a society as a whole. And that's been agreed by the Prime Minister, the Premiers, and we've agreed that with the Australian public.
That's Federal Education Minister Alan Tudge. But with widespread vaccinations for children weeks away and many schools closed, concerns remain. To discuss those, I'm joined by a panel of experts. Anne Holland is the National Children's Commissioner. Professor Robert Boy is a Senior Professorial Fellow at the Children's Hospital Westmead School of Child and Adolescent Health. And Professor David Isaacs is a Clinical Professor in Paediatric Infectious Diseases at the University of Sydney. Welcome all of you to RN Breakfast.
Thank you.
David Isaacs, let's start with you and what we know about how children are being affected by COVID-19. There's now been several hundred cases of COVID in children in those states with Delta outbreaks. How sick has it made them?
Look, it hasn't made them desperately sick at all. We've had very, very few admissions to hospital from children. What has affected children, I would say much more, have been all the lockdowns, the closure of schools and so on. So they've been severely and disproportionately affected by COVID-19, I believe, and we've neglected them.
We'll come back to the lockdowns and the impact of the lockdowns, but just in terms of the Delta strain and its impact on children, what's it like on a children's... I mean, you said that there haven't been many kids admitted to hospital, but do they receive the same kind of treatment as you're using with adults? Are parents able to be there with them?
So there've been, overall in New South Wales, just recently, it was announced there've been 2,674 children infected and only 75 hospitalised. And of those 75 hospitalised, almost all of them have been for social reasons. They're almost like COVID orphans because their parents are so sick that the children have been admitted for us to look after them, sort of a home in the hospital for those children. So children do not get sick. There are many more children being infected with Delta strain, but actually getting sick. I watched Q&A last night and there were some very worried children there, but they don't need to be so worried because children very, very rarely get very sick with COVID.
So you're confident in this? You're confident the evidence is telling us that they are vastly less susceptible to serious illness?
Absolutely. They can spread it to their relatives and within families, and that's a concern. But the children themselves do not get sick with COVID. Very, very rarely.
What about between younger children and those who are a bit older, teenagers? Is the virus affecting them differently, or does it not really impact in that kind of on that serious scale until we see people getting into their late teens and 20s?
Yes, good question. I mean, the younger the child, the safer they are. So very young children are either asymptomatic or get runny noses, but are really not, cough maybe, but they're really not very sick. Older children behave more like adults the older they get. So the teenagers are the ones who are more likely to get anything, if you like.
Robert Boy, we heard the Federal Education Minister speaking on the show yesterday saying the national COVID recovery rollout plan factored in children by ensuring the adults around them are mostly vaccinated. Will widespread vaccination, in your view, among adults be enough to keep children safe?
Well, it'll make a big difference. And in fact, when we say adults, we've got a program now starting at age 16. So we've got teenagers as well being protected and reducing transmission as a consequence of that. The Doherty model, which was only released 2 weeks ago, suggests that adding in 12 to 15-year-olds who are healthy to the vaccination program will add very little to preventing transmission. It won't help with herd immunity. We've got enough supply right now to extend from over 40 down to 16 to 39-year-olds. That's the big plan right now, they are the transmitters. They're the people who are spreading the infection in the community. And if we can get a really high rate in 16 to 39-year-olds over the next month or two, we can make a really big difference to transmission as well as to severe consequences in older adults as well. So the goal really is to get older children, teenagers from 16 and above, vaccinated. And for 12 to 15, there are a small group who are at real risk of complication, and that's kids with Down syndrome, cerebral palsy, immune deficiency, heart and lung chronic problems. So there really are a priority to vaccinate in the near future. But healthy 12 to 15-year-olds can form an orderly queue and be vaccinated a little bit later.
And we should say that Indigenous children too, there is an effort underway to vaccinate them earlier too, in that 12 to 15 range.
Yeah, and sorry, I should have mentioned that. In remote areas, children in remote areas and Indigenous children are strongly recommended. We're really worried about them right now. Unfortunately, I agreed to do an interview for Dubbo half an hour ago, and they forgot to ring me, and they ring me 6 times while I'm waiting to talk to you, so they really must be concerned too.
We'll return you safely to Dubbo shortly. But yes, the spread in the western parts of the state's deeply worrying. And Holland, Alan Tudge says the government's 4-stage return to normal, so with adult vaccine thresholds set to 70 and 80% of those eligible, is what the states and territories have agreed to, and that will allow for schools to be reopened. What do you make of that? What do you think of that approach?
Well, look, I think the states are actively working on this now, and we expect to hear something from New South Wales today, which is fantastic. But I think it's really coming very late in the day, and I would have much rather seen, and I'm still calling for, a national COVID recovery for children strategy where we really recognise the importance of schools, not just for academic learning, but for all of those social, emotional and wellbeing elements that, of course, are the foundation for academic learning and work readiness and life success, but also to protect the mental health of children. And we're not hearing enough about the mental health concerns that have increased, such as Kids Helpline having seen a 50% increase, and much younger children with much more serious concerns. And I think we may have overlooked the important role that schools play in mental health and wellbeing. We've assumed that school can be replaced by Zoom. So whatever we can do to get a multidisciplinary and multi-layered approach to weighing up the health factors and then rearranging how we do school, looking at the reducing class sizes, staggered attendance, all of that. Schools should be the last places to close and the first ones to open because they are so important to the wellbeing and development of our children generally.
And as you say, so there's a lot of headlines around this week about NAPLAN results that's showing that, on average, school kids aren't going backwards on literacy and numeracy. But what you speak to is the social cost of schools being closed for kids. You've warned of a lost generation because of school closures. Tell me a little more of what you meant by that.
Well, look, I just think it's that we haven't placed children as a national priority during COVID. It is year 2, and we've constantly expected them to wait till, we get back to school. But in the meantime, there are kids that are missing out, and there are 3 groups that I'm particularly worried about. It's the younger children, where school is mostly about that social emotional development, not so much about reading and writing, and they're missing out on the basics. It is the kids with disabilities, the special needs, where the social environment of learning is the richness of that cannot be replaced at home, and it's much harder for them. And of course, I'm also worried about older kids, not the year 12s that we hear about all the time. Not so worried about them. I'm worried about the ones who were maybe a bit disengaged and struggling even before COVID, and now we won't get them back. They'll probably be lost for good. And I think, just as we've been helping struggling businesses throughout COVID, we now need to look at struggling children, and there will be children struggling today, and as schools reopen, what extra help are we prepared to give them so that they don't miss out for the rest of their lives?
David Isaacs, and describing their younger children, kids with disabilities, older kids who are becoming disengaged, are those the kinds of kids who you were referring to in a clinical setting that you're most concerned about in terms of the immediate impact of Delta?
I couldn't agree more with Anne. I think we have neglected the children. We've closed schools, I think, too early. We haven't protected the teachers enough. We need to get the teachers immunised. I heard someone this morning on the radio, a teacher saying, why aren't we being prioritised? Because the teachers want to be safe, the parents want to be safe. We need to immunise the people that the children might infect, because they're scared of infecting their grandparents and their own parents. Immunising children is less of a priority. I absolutely agree with Robert about the need to immunise the most vulnerable children, but we need to protect the people around those children and get them back to school as soon as we can.
Robert Boy, let's talk about that classroom environment. What needs to happen in classrooms to make it safe for children who aren't vaccinated to return to school?
Well, I've been consulting with a really good friend in the UK who's a head teacher of a primary school, and they've been under the pump now for many, many months, and they're just starting to open up this week. What they did, even in winter, was have the windows open to ensure ventilation. They had teachers moving from classroom to classroom, not students. They didn't have pinch points corridors where children were crowded together. They had some use of masks provided you were 11 of ages of above. They had social distancing. They had sequencing so that kids arrived at different times in different places at school and left school at different times in different parts of the school. So all sorts of practical things that are actually doable were implemented, and they had hardly any outbreaks. They have what they call bubbles, little classrooms where children are exposed to each other, and if one is a case, then the others are tested and may have to be isolated. So there are things that can be done: testing, social distancing, sensible timetabling, and that can make a real difference.
And what about for the under 12s? I mean, no vaccine, of course, is approved for use on the under 12s yet, but primary schools and daycare are very different to high schools. So do we need to be looking at a specific plan for kids in different age groups? They behave very differently at daycare as compared to an ordinary day in a primary school, for example.
Yeah, David's said it very nicely. We need a chain of protection. We need to have a ring of vaccination around those children, and that includes their parents, their teachers, and anyone else who comes into contact who works at schools, who's an adult. So differences we can make a difference. Preschool, yes, snotty-grotty, but they're not bioterrorists. They don't mean to do it, and we can manage it. We can teach them even at preschool hygiene measures, hand washing, social distancing, and of course they won't be nearly as compliant, but they can start to learn. And primary school kids are getting pretty good already at playing by the rules. And so, yes, we have to treat them specially, differently, and we have to form that chain of protection around them.
Anne Holland, I want to come back to you. Should vaccinating teachers and school staff be mandatory, do you think?
Well, look, I think there's some legal barriers to that at the minute, but I think as part of that chain of protection, certainly teachers should be prioritised and parents should be strongly encouraged as well. You know, like I think it's about putting children at the centre now and their health and well-being, and it is much more than about them as spreaders to adults. We need to think about them in their own right as having needs that should be protected now.
And you're obviously thinking about the longer term effects of this pandemic for children, and we have spoken a lot about the dangers, the negatives of enforced isolation. Are there any positives to this that you can see?
Well, look, the positives that I can see go to what we're discussing this morning, and that is the importance of focusing on children and recognising that they have unique needs that often are not addressed in policy that is focused on adults. And so recognising, for example, that schools have a broad role in terms of protecting their well-being on all these fronts that we've discussed, I think is an important recognition and realisation. And I would like to think that the pandemic will have taught us that we need to pay much more attention to children, make them a national priority, and organise systems like health and education systems in ways that place them at the centre and their well-being, and support their parents to raise them well. And unfortunately, at the moment in Australia, children are not recognised in that way. So that's the positive that I'm looking for out of this.
Indeed, and it's all about building those chains of protection, if I'm hearing you all. Thank you so much for joining us.
Pleasure.
Thank you.
Thank
Anne
you.
Holland is the National Children's Commissioner. Professor Robert Boy, who now needs to go and talk to Dubbo, is a Senior Professorial Fellow at the Children's Hospital Westmead School of Child and Adolescent Health. And Professor David Isaacs is Clinical Professor in Paediatric Infectious Diseases at the University of Sydney.